Thank you very much. This is the last session before the lunch. I know you're hungry. So I would like to invite the last speaker. He will present to the Mevion systems. And he's coming from Turkey. He's the senior vice president of the medical healthcare company in Turkey. Mr. Gokay Celik, please go to the stage.
Thank you for the great introduction. I would like to thank you for the committee for inviting us, especially Nadim. So I'd like to briefly give you some information about mental health care, a few slides, and move into protons, where you can explore the new things with protons. So as mental health care, we were founded in 1984. We have great presence in radiotherapy since 1984. We deal with cobalts, Linacs, Accurate systems, and we've been following protons last 15 years or so. Started with Dr. Mackey with CPAC project. Some of you may be familiar. So we choose to work with Mevion, and this is our decision to work with Mevion, the great leader in proton therapy, together with Leo. So as I said, we have thousands of employees with under 14 companies. We have centers, we have manufacturing, and we're also dealing with distribution. So we are distributing Mevion in 20 countries. So I'd like to go to the Mevion site real quick for the sake of time. So regarding the Mevion, so Mevion is started in 2004 and has been greatly developing their things. So regarding the protons, thanks to our friend Mo, he explained greatly about the benefits of protons and how it should be accessible to more people and how we can use in more indications. So I don't want to get into more in details. So you can use basically protons in many of the things. It's a matter of cutting the cost. So cost is the biggest barrier in protons. So I would like to introduce you to Nadir in the proton therapy world. I would like to introduce you to two of our systems, S250i and S250 Fit. So they're both available for sale. For those who wants a gantry, for those who wants to implement the systems in an earlier time, this S250 Fit is the right choice, similar to Stanford University. So Mevion was founded in 2004 by the MIT and Harvard collaboration. So this American company based in Littleton, Massachusetts. So they have installation in US, Asia, and Europe. So this is the only vendor who can actually fit a proton system into a Linac vault. So it takes under 2 years to get the first patient instead of waiting for between 6 to 10 years for standard proton systems. So Mevion is the leader in the US right now in terms of installations for the single vault systems. So there's a transition towards single vault systems and faster implementations. They have systems in 10 NCI centers, and you can see that it's growing and growing. Another second big market is in China. So Mevion is highly developed there. They have 2 manufacturing facilities. So total together with manufacturing facilities in US and China, they have capacity to produce 35 systems a year. So like our friends mentioned earlier, there are generations of protons. It started in 1960s, and then it went up to 2024. Last 2 generations were coming from Mevion side. So we like to be the Apple or the Nokia. So regarding the generations of protons, protons are good, but it was too big. It used to take hundreds of millions of dollars, 10 years. But now you can actually implement, like Stanford University did. You can actually put on a actual radiotherapy department like another radiotherapy system. So regarding the NCIs, most of the NCI centers since 2013 moved to Mevion for different reasons. So regarding the upright centers, there are many upright centers going on. Also, some of the old gantry centers are moving towards upright. Loma Linda is the first center in the world who had the gantry for first generation, but decided to go to the 4th generation. And then Stanford is another one, which pioneered and invented Linac and later on CyberKnife. It's also going with this approach. So regarding the conventional proton therapy, beamlines and the big gantries was a big hurdle. it was taking really long time to implement those. There was a lot of problems. Almost 60 or 70% of the projects were not completed under 5 or 6 years. So most of the projects are going beyond 10 years or being canceled. So this is also the problem that we see in Saudi Arabia or Egypt or in Georgia. So eliminating beamlines are very crucial. It's important things. So many companies try to use beamlines, and there were a lot of fails for the companies that would try to use beamlines. So eliminating long beamlines is very important and crucial for serviceability, clarity of the protons to be delivered to the patients, and so on. So Mevion is eliminating this by introducing the Mevion 250i Hyperscan and Mevion S250 FIT. So you can choose either of them or both of them at the same time. So regarding the innovations and being leader in the technology, Mevion, together with MIT, they introduced the first and the smallest and the most compact single cyclotron in the world in 2010. And it created direct beamline in 2013 with the Mevion gantry. And 2018, and still the only company that produces MLC since 2018 using the pencil beam scanning technique. And there are other companies that would try to create hedgehog techniques, but until now it wasn't successful. In 2025, together with Stanford, Baker, Nebraska, Lomani, the biggest names in the industry, they moved to 4th generation S250 FIT. So what is different, the main technology differentiators? There are many of them. For the sake of time, I'm not going to go into it. But like it's been mentioned today, on treatment isocenter, fan beam CT is very important. So this is a crucial thing. You don't need half gantries or partial cone beams to do better proton treatments. So you're putting a lot of efforts in the protons, but you need the right equipment to do that. Shoot-through beam, I really advise you to look at the article that was written by Stanford University for that. So these are new capabilities for protons, so you can be reaching more and more patients. So why Mevion? Mevion is the only company that made a small cyclotron that is good enough and that is very strong in terms of single cyclotrons. So by doing that, they used niobium superconductors to be able to do that. So with this kind of single cyclotron, you can actually do flash, radiosurgery, hyperfractionation. It helps you do other treatments and so forth. So regarding the Mevion S250i, it has a compact print. It has all IGRT solutions. You can do cone beam or fan beam CT. You can do adaptive. You can do arc therapies, hypofractionations, radiosurgery, or flash. So anything that's available is also available with S250i. Biggest challenge that we see in markets like here or our region is the length of the project. So in terms of that, gantries are creating a bit of a challenge. So as you can see, it's a 100-ton gantry turnaround. This is still available, but there are better solutions that you can move into. So like we said, Mevion is the only producer for Proton MLC. You can create 3 times sharper dose. You can treat the patient faster. Like I said, Stanford has published a shoot-through beam, which you can do actually single breath hold and do lung SPRT under 10 seconds. So I would like to show you the hyperscan speed, if it allows us. So it's very fast and very efficient. Another point is with the short beam lines, you can actually do very fast layer switching and also do energy switching times are very fast. So that enables for better arc treatments and faster treatments that is available with protons. Another example is for the arc treatment, being fast and efficient is represented here. So there are different approaches for static arc, dynamic arc, direct arc. We think that it's best for continuous beam and continuous treatments with ultra-fast energy switching and without any constraints. So that we think that direct arc is the best way to go. I'd like to give a few examples regarding flash test. Right now, any systems that has single cyclotron can do flash. So it's more research site, but it has a lot of promises. So regarding the streamlined adaptive online radiotherapy, Mevion is the only solution right now in the market where they can do with S250i and S250 FIT. And this is the publication done by the Washington University and the clinical trials regarding online adaptive radiotherapy, proton therapy. So this is very important. I will suggest you to go through this article. So like we said, the proton has been changing. So instead of off-site or far on-site centers, embedded proton center is more welcome these days, and it's part of the radiotherapy department. So you can use the same staff and same people, and you don't have to cross-train them, or the doctors don't have to stay away from the radiotherapy departments. By doing so, the space is important for protons. In order to do the protons effectively, proton treatments effectively, and in order to complete your projects, you need to do things in fast pace. So let me give you an example. Instead of a very large area, you can actually use an existing Linac vault, like Dr. Rakmaki said, who is the founder of tomotherapy and many things in radiotherapy. So it's easier to do that. Let me give you an example in terms of construction. So this is a second generation installation in Europe, and it's versus a fourth generation installation. One is like a nuclear plant, which takes 4, 5, 6, up to 7, 8 years, depending on the project. Or you can have a system installed in a couple of months and start treating. So you can complete 3 or 4 projects, up to 5 projects at the similar time level as you can do in a large construction. As you can see, the patient positioner and the CT installation is already over. Cyclotron has been pushed in, and now it's just up to mechanical installation, finishing, and the rest of the finishings. So this is the idea. So I'd like to introduce the 4th generation system, that is S250 FIT, the first pioneers. The first system was installed in the factory. Mevion is the only manufactured as a system in the factory, being tested all the time for trainings and everything. And the first system has been clinically installed to Stanford University. Others installations already started. And then there is a big change towards the Mevion S250 FIT Linac size proton therapy systems. You can reach to treatments in 360 degrees. You have a diagnostic dual energy CT at the ISO center, treatment ISO center. You have a fan beam CT, which can do daily online adaptive. And you can do arc therapy. You can do flash, SGRT compatible, and spectrometry compatible. Thanks to the Leo and Mevion partnership, they made this dream come true. So let me give you an example how the system looks like. You have the accelerator, which is the cyclotron, single cyclotron, and you have the patient positioner, upright patient positioner in an 11-way. So you can actually, and then you have the CT on top of it. The good thing with these systems, you don't have to build your proton systems for your device. You actually have a bunker that is usable for today proton, tomorrow maybe MR-guided protons for whoever knows. But these are all 3 individual modules that you can actually replace with each other. So I'd like to go into more direct beam technology, why it's important. If you don't have direct beam line, and if you have a long beam line, you have to generate a lot of protons and neutrons in the back, and you have to have a large beam line, and then you waste a lot of protons in that. So you don't have that efficiency. So by having a direct beam line and MLC with the protons, you can actually modulate the beam, and you can also easily switch energies, and you can treat the patients in a much faster scheme and much more effective. So S250 FIT is almost like a TrueBeam size. It's exactly a Linac size system. I will give you an example of the installation of Stanford Health. It's actually like an installation like an MRI, but you have the protons in the bunker. So this is the first clinical center that has been installed. I would like to show you the department. This is the way to the Proton system. Basically, you go inside, it's like a normal Linac vault. And this center actually, this was the world's second turbine was there, and they deinstalled it and installed a Proton machine instead of this. And it's fabulous. I mean, this was a dream of all the companies in Proton field. Some of them saw this, but many Proton vendors who tried to do that, this doesn't exist. As you can see here, there is a cyclotron in the back, and the efficiency of the system is quite high. So there are other projects like this. It's either a Linac building a new vault, or renovating an existing vault, or anything is possible. So you have to dream big. You can start the Proton treatments as fast as possible. So it's now Protons is not a dream anymore. It's doable. So our goal is to complete all the S250 fit projects under 24 months, including the construction to get the first patient. So it's a very seamless project, similar to CyberKnife, MR Linac. So this is no longer a dream anymore. So I'll give you examples of some of the projects if you want to get a full system as a S250 fit, or like in Wisconsin University, you can actually upgrade your system to upright positioning system with the patient positioning in the FemBeam CT. You can see the size difference of the two systems, and then, of course, the capabilities of the upright is much larger. Our friend has mentioned that there is not much patient has been treated upright, but a lot of the centers, including PSI, Northwestern, MGH, has been treating upright for Protons with Protons. So there are a lot of benefits of that. Actually, there are publications that has been made in France about this. Patients feel a lot more comfortable upright comparing the spine position. And for those that are more familiar with the spine position, of course, the gantry is still an option with S250i. But there is no any indication that you cannot treat with the upright positioning, head and neck, breast, lung, prostate. So you can cover from your legs up to the brain, any kind of pediatric positioning, any kind of adult positioning is possible, and you can treat all with Protons. So these are the clinical proven upright studies. I don't want to go through all of them. There is a big benefit in thorax, abdominal region, head and neck, especially. And then, and during the FDA procedures, Leo and Mevion have submitted hundreds of cases from different parts of the body. And then none of them were inferior. All of them are equal or superior in upright position for Protons. So I will give you one of the publications that was done this year in 2025 by Mass General Hospital, Harvard. So they show different cases, and actually a few months after this, there was one of the other Harvard centers have actually decided to go with S250 fit. So there are some of the clinics that I reviewed for upright Protons from UW Health, from Miami Cancer Institute, where they're using the second generation Protons. So as you can see, both the upright and all kinds of 20 degrees front or inclined positions, you can produce plans that are equivalent or comparable to conventional spine plans. So this has been said by one of the most influential persons in the proton therapy world. I'll give you some of the examples from the upright world. These are the centers that decide to go with upright. So there is a big change towards upright. We expect to see by 2028 or 2029, 50% or more centers in proton world will move to upright positioning system. So with Mevion, actually we see a big clinical excellence in with Mevion. You can treat all kinds of indications from brain to CNS, head and neck, breast, lung, prostate. There is no limitation on pediatrics or any kind of proton indications. So you can treat all kinds. Different sites and different countries have different rules. So based on those rules, you see different habits, but you can treat them all. So I'd like to show you one of the sites in Florida that are treating between 50 and 65 patients a day with Mevion system. These are their wrap up. So in the month 4, they were actually treating 50 patients a day. So which is unimaginable with any other systems. So regarding the usage, Mevion system has the lowest consumption for energy, staffing, and you can treat up to 3 to 5 patients per hour. There are sites that are treating 6 patients an hour. And there is a great global service has been set up. And in the region, we're also setting up a big warehouse and regional support covering these regions. Another big benefit is that you can use this system 24 hours, 7 days a week with 95% uptime. You don't have to service the system during the day. And there are just, it's like another Linac. Like Sasha has mentioned, it's pretty much similar way. You can actually see the benefits of Protons like in Linac base. So I would like to briefly finish the talk. So why Mevion? So it has the highest technology and clinical benefits in the industry. Treatment speed and daily capacity is very high. It's a fast implementation, and you can put the system in a Linac vault. You can treat all spectrum with IMPT, SRS, SPRT, or ultra hypofractionation. Or you can even treat shoot-through beams or mini beams or online adaptive with these systems. So it has a very high uptime with 24/7 working principle and lower operational cost. So in Proton's sustainability is very important. First and second generation centers are closing down in many of the worlds because of too many staff, too many requirements for constructions, electricity costs, and other things. So in order to drop the per patient cost, you need system like S250 Fit, 4th generation. So sustainability, technology, and clinical choices, and of course the financial choices are important for durability of your center. I'd like to thank you all for listening to me.
Thank you. Thank you very much, Mr. Gokay. Just only one quick question. Is there any question in the room? There is one here, yeah.
We have the current speaker who is from Mevion. So I have a quick question. See, since we have a Proteus Plus, we are working with the Proteus Plus in India. So there, even though with this one cyclotron, we have 3 gantries. So it's very difficult. While one patient is in the couch, then we have to divert the beam to this patient. Simultaneously, it is very difficult to treat 2 patients, okay? So I've seen here with Mevion, you have one cyclotron and one
Correct.
Correct. And also I have seen with Proteus, the problem is it's still we are with IMPT, right? And
Yes.
here I think you have HyperArc.
It is IMPT, 2nd generation IMPT with Hyperscan. So it has IMPT with the pencil beam scanning, basically, with the MLC in front of it.
So my question is, how will it reduce the time? Because we all know proton treatment needs time.
Correct. So there are few things. Let me show you. So your system is similar to what I'm showing on the left. So basically, when you have one cyclotron and you have different magnets, direct magnets or bending magnets that goes into beam lines. So basically, you need different angles. So one of them that is account for the time factor is layer switching and energy switching time. Energy switching time with Mevion is down to 50 milliseconds, comparing the 5 seconds with or similar to that in those conventional systems. Plus, layer switching is much faster here. And also, you can use beams between 2 millimeters up to 13 millimeters. So you have choice of choosing the beam. So you basically, in the penumbras, you choose small beams with MLC, but on the middle, you can enlarge the beam. So by doing these and having faster direct beam delivery, you can actually decrease the total time, and you can use ARC to even further decrease the time.
I think I think we can, continue the discussion in the outside because we already, finished all the time, time. We have a 1 hour delay and also lunch is waiting there. So you can continue your discussion in the outside, okay? Thank you very much.
Thank
So
you
I
so
have a
much. Thank you.
session.